One of the great worries that every patient has who's considering facial rejuvenation is how they will look afterwards. It's perhaps one of the things that holds people back from having any work done the very most. So it's very important to understand what our concept is of what we're trying to achieve. And that is, first and foremost, a very natural look and unoperated look. If you look like you've had an operation or indeed treatments with Botox or fillers, then you've had too much or not done properly. But that does not need to be the case. Let's look first of all at the non-surgical treatments, the Botox and the fillers. We like to start philosophically and in reality with a lower rather than a higher dose or volume of those materials. We just try to get some improvement. And then we assess the result with you and say, how do you like this? Sometimes patients will come back and have a little bit more. And that's just fine. That's much better than putting in too much. Our goal is not just to put in as much Botox as we can or put in as much filler as we can, but it's to sculpt the face artistically, aesthetically, so that we can achieve the result that you wish to have. Now that may well be different from one person to another, but the overriding principle in all cases is a natural look that's not done. Now similarly, when it comes to surgery, such as eyelid lifting, or face and neck lifting, or forehead lifting, or indeed rhinoplasty when we want to just maintain a nice natural looking shape to the nose. The whole goal is that we put our tension or our lift on the underlying tissues, that we lift what needs to be lifted, we remove what needs to be lifted. But again, I consider these surgical procedures sculpting procedures. They're not ablative procedures where we do as much as we can. We do as much as we need to. Do we achieve tremendous improvements? Can we remove a tremendous amount of skin with a face and neck lift, or a fair amount of skin with eyelid surgery? The answer is yes. But we always take just that very, very little bit less than more to retain the natural look for you. Now your side of the bargain as a patient is that you have to recognize that our goal is a tremendous improvement, a refreshed, unoperated, more youthful look. But it's not a look that can take you back to when you were 20, if you're 40 or 50 years old, but just a look that's very much a significant improvement and not perfection. If you can be satisfied with that type of improvement, then we, the surgeons, can achieve that for you and really help improve your quality of life and the joy that you have each and every day when you look at your face in the mirror.